Welcome to the We Talk Health Podcast, the official podcast for West Tennessee Healthcare. Please be advised that this podcast is not intended to replace any medical advice. Always follow your medical professional's advice and direction. Nothing said in this podcast is intended to supersede or supplement the direction of your medical caretakers. If you have any questions, please reach out to us at wetalkhealthpodcast@gmail.com, and we will do our best to answer any questions you may have.
Welcome to another episode of We Talk Health. My name is Kwasigroh. Today we're going to be talking about the benefits of water. With me today are Cathy Sudbury. She is the Sports Plus Marketing Manager. Alissa Inman, who is a PT, Aquaticist, Program Manager at Aquatherapies in Jackson, Tennessee. And Kathryn Clegg. She's a PT, MDT, and the Program Manager of Sports Plus in Dyersburg. How are y'all today?
Good. Well, thank you.
Thanks for coming.
So today we're going to talk to you about the benefits of physical therapy in water. And the reason we have these ladies here today is to discuss how the water helps your body heal itself. So I'm going to ask Alissa to describe what the benefits of water, and then we'll talk about why each one of those can help you.
Essentially, when we're using water, we're using 4 different principles. We're using buoyancy, the temperature of water, hydrostatic pressure, and viscosity. Buoyancy, that decreases a lot of the weight bearing, the stress on the joint, so you're offloading, less impact, so you're able to move with less pain. The temperature of the water, depending on what's going on with you, if you're having a lot of muscle tightness, a lot of pain, warmer water seems to helps relax those muscles. And then the hydrostatic pressure, that can help with swelling. It can also help, like as you're moving through the water, with your balance as well. And then with viscosity, you're using that's the drag in the water. So that's helping aid in strengthening. So those are kind of the basics of what we do with water and therapy.
Okay, so when we're talking about the benefits of water, we're talking about physical therapy in water. Alissa, if I understood you, so there's 4 properties, and all of those work together, correct?
Mm-hmm. Yes.
And how do you decide who's the best candidate to go in water?
It's a great question. Most of our patients, if you're compression sensitive, which means you have a lot of pain with weight bearing, so if walking, standing, any of those type of tasks, or you've even tried land-based therapy, traditional land-based therapy, and you just didn't really improve, those are kind of our primary candidates that benefit from the water.
Can anybody come over and take it?
Yeah.
So it's not just limited to people. My understanding, water is probably about the best thing that could be for a physical therapy patient that are in pain, that just normal standing, touching your toes, moving any direction it hurts.
It decreases the weight-bearing load or the compression on your joints. And especially like with lower back patients, it kind of almost creates like a traction effect in the water. It helps just offload, give you a little more space, and it helps you move better or more freely. The water is also good for patients that are post-operative. So if you've had, a total knee replacement, of course, once the doctor clears you for water, with that, it again decreases a lot of that weight bearing, that load on that joint. Also with the hydrostatic pressure I mentioned, it helps with the swelling component.
So I've had surgery and I'm able to get in the water. And how's that work, Kathryn?
Well, a lot of times with our post-fractures that may still have weight-bearing limitations, we're able to get them in the water earlier, and they can start walking, and they don't have the load that they would have on land. It helps to normalize their gait pattern, increase more free movement of the joints, and speed up the recovery process.
So when y'all are saying the load, in layman's term, it's like you're lighter in the water, correct?
Yes.
And it's taking the pressure off of, because I've always heard that the water up to your waist makes you about 50% lighter.
Yes.
Is that correct? So the general public don't realize that once you get in that water, you're not as heavy pressure pushing down on the joints, and that's what you're telling us, correct?
Correct. Yeah, and depending the level you are at in the water, like you said, if your waist depth, that's about 50% weight bearing. If your chest depth, you're only bearing about 25% of your body weight. And so, like at our pools here in Jackson, we can position you in the water to best aid in your recovery, so get you to the proper weight bearing. Even if you're having shoulder pain, if we can get you deeper in water, we can even work with that joint, because a lot of people think you can't do shoulders in the water, you can't rehab that in the water, but you can. The general principle is you want to submerge that joint in the water, but so we could even get you 10 to 15% weight bearing in the water and initiate that process.
What if I'm scared of the water?
That's okay. We get in with you.
So you're able to help coax the patients in and work with them on that?
Exactly. Now, some patients, I will say, if they do have like a lot of trauma and significant fear, it may take a few sessions. And if we see that you're not going to break through that, we know it's not best for you, but If anybody is ever afraid, not comfortable, we get one-on-one with you in the water.
That's good to know.
Yeah.
I guess a lot of people might think that you're sitting on the side of the pool saying, hey, lift your leg, or hey, move your arm, or whatever, but you're actually in the water with them.
We'll get in with
like
water, yeah.
Holding their arms, holding their hands to make sure they're staying in balance, and really gives that personal connection that you're there with them. That's really cool.
So how does that physical therapy work? When they're in the water and, we see you in the traditional way, we see you standing beside them. So you're in the water with them and you're giving them certain exercises. Is that what you're doing?
Yeah. We tailor, like each patient that comes in, we start with an evaluation that is land-based. And from that, we can tailor an exercise program that best fits the patient. Like I can give you an example with spine patients, leaning forward versus leaning backwards, or what we call flexion versus extension. We can more tailor those exercises to fit even that population. So they're very specific, very patient-focused. They're not just a general exercise, do this, do that. And then if they need help, like we can physically help, move the leg through the water or kind of block or adjust the range of motion to what the patient can tolerate.
Kathryn, we have you here today. Most people know Aquatherapies here in Jackson, that they have their pools here, but a lot of people don't realize with Sports Plus, we have 4 locations, Dyersburg being one, correct, that you have a pool there?
Yes, we do. And we have an endless pool, which has the current that can swim against or walk against. Our pool is a little bit smaller than the one at Aquatherapies in Jackson, but with the endless pool current, it does allow for swimming against the current with some of our higher level athletes, post-ACL patients, and different ankle injuries, different things like that. And then also our pool, the deepest part of our pool is about 4 to 5 feet. So that sort of makes it a little bit nicer for some of the population who may be a little uncomfortable with being in the water. They can usually stand up at any part of our pool. So that makes them feel a little bit more comfortable as well.
See, that's great. You touched base on a couple of things there. You mentioned athletes. Is there a specific program for athletes in the water?
Well, I actually took a course that it focused on athletes, and it was aquatics for the elite athlete. And it did focus on various injuries or even just conditioning for athletes in the water. It combined water and land at some point, but you can really push and challenge even that type of patient in the water. So yes, with athletes, you can challenge them in the water as well. We can do running, jumping, lots of cardio. We can even challenge their balance in the water.
Balance, how's that going to work? I mean, does that work with just the athletes, or does that work with all patients, or is there demographics?
Any patient.
Any patient.
Any patient that's having balance issues, we can get them in the water. It's actually a safer place to challenge your balance in the water because with the viscosity that I mentioned earlier, you have that drag in the water. So you have more of a time to correct your balance. With that, and again, we're one-on-one, especially with our balance patients. We can take them through specific balance exercises. We can add different directions of movement. We can add cognitive overlays, just different things to further challenge their balance. But with that, with the drag in the water, like I said, as we're going through, they have more time to have a righting reaction. And so on land, you might just go ahead and fall. I mean, of course, if you're in therapy, we're there with you and we're not going to let that happen. But you're able to kick in your muscles more and kind of train your body to help prevent those falls or have more of a time to react to the fall.
Sounds like, too, in the water, you don't have as much of a fear of falling, where if you were standing out on land, that mind automatically thinks you're falling with a balance issue. But in the water, is that way it's helping correct that fear of falling?
Yes.
And I think that's especially important for the elderly population, especially patients who may be using an assistive device on land to walk. That sort of promotes an adjusted posture that the water can help to correct and help them to normalize their gait and normalize the correct walking pattern. It also can be very effective for patients who've had compression fractures or osteoporosis. And again, it takes away the fear of falling, but also helps to improve their balance through making those subtle adjustments in the water.
So if a physician sends me for physical therapy and he doesn't mention Aquatherapies, is there a way we can be converted over to do Aquatherapies? I know I have the right to ask for it, first of all, and I think that's the general public needs to know that it is your right to ask for something like this. But if, say, you got one in Dyersburg and it came to you for just general physical therapy on land, but you feel like that patient can go in Aquatherapies, is that your call? Are you able to do that?
Absolutely. Typically, we will consult with a physician and put that in our plan of care if we feel like the water-based exercise is going to be the best route for that patient. A lot of times when they are not able to tolerate land-based exercise because of pain prohibiting them from tolerating the land exercise, we can start them out in the water and they're able to tolerate a greater amount of exercise and a greater duration of exercise, and then we'll progress to land-based exercise as well.
So when you're saying land-based, a lot of people don't understand that's just strictly normal physical therapy that's outside of the water.
So, Alissa, earlier we mentioned that you're an aquaticist. Was there a program you had to go through to get that, or what exactly does that mean?
Being a physical therapist, we have continuing education standard that we have to do. And since I am primarily in an aquatic environment, obviously that's something that's very interesting to me.
Sure.
And we went through, my clinic went through a series of courses, and it's different things. So like one was more based on female population and, like maybe a patient that's had cancer, had a mastectomy, how you can work with them in the water. And then one was focused on the athletes, like I mentioned earlier, and pediatrics. So it's like you're going through different patient populations. And at the end of it, there's a little test, but you can come out with an Aquaticist certification.
Okay.
And there's 4 at my clinic that have it.
Kathryn, is there certain diagnosis that would benefit more than other than just the general ones we've been talking about? Is there, I know, like maybe chronic pain patients?
Yes, chronic pain patients, patients with fibromyalgia, they do tend to respond well in the water. And again, their tolerance for and their endurance with exercise is improved in the aquatic environment.
So that's back because of the benefits of the water and taking the pressure off of their joints and helping relieve the issues they're having from the pain, correct?
Yes, and the water allows more free movement. Patients tend to feel more comfortable in the water. It does help to reduce the pain, but it also allows more free movement of the joints, which helps to...
Well, it helps to alleviate pain, and it helps with their range of motion. Because a lot of times patients that are in chronic pain, it hurts to move. They don't want to move, so your joints get stiffer, your muscles get weaker, your muscles get tighter. And so with the properties we mentioned earlier, especially the warmth of the water, that helps decrease a lot of that pain, increases the flexibility of the joints. It also decreases the tightness of the muscles. So fibromyalgia patients usually do really well in the water.
Well, let me ask you this one concerning question that I know several people out there are listening. Do I have to wear a swimsuit? I don't want to come to a pool, to a pool. Is it okay to wear shorts and T-shirts? What's the appropriate wear?
Yes, you can wear shorts and a shirt. Of course, we tell our patients make sure it's not 100% cotton at our pools, so it has to be a blend.
Why can't it be 100% cotton?
It can clog our filters. We want to keep our pools nice and clean and sanitized. And then I also make sure I tell my patients, don't go toward the lighter colors, your pastels, your whites. Do remember, we are in a public environment, so if you are going to wear shorts and a shirt, wear a darker color. I've even had some patients, just based on whether it's their comfort level or could be a religious background, they wear like capri length pants in the water or longer. So, we cater to anybody's needs. Our biggest thing is we want you to feel comfortable. Our goal is to get you better. We're not there for a fashion show. We're not there to judge anybody. So if people are comfortable in a swimsuit, wear a swimsuit. If you'd rather wear the shorts and the shirt, that's fine too.
You mentioned the temperature. What's the temperature of the water? And why is that? I mean, you said the warmth is great, but exactly why is that detailed?
Well, and at our facility, we have 3 pools. The warmer water, like I mentioned with the patients that have fibromyalgia, it helps decrease a lot of muscle pain. It also decreases a lot of muscle tightness. If you have a patient, let's say they have multiple sclerosis, or they could be a patient that has cardiac issues, you want to go toward a little bit cooler temperature. So you're not stressing them out as much. You're not fatiguing as much. Our pools, our warm water pools, are usually between 90 to 93 degrees. If we have to cool one down, it's usually around 88. So it's still not super cold, but we can tailor that to whatever the patient needs as well.
Is there a standard at the Dyersburg clinic as well?
Our pool's usually kept at 92. We only have one pool, so we have to keep it at a standard temperature, and it's usually at 92 degrees. You can tell a difference if it's even 2 degrees change. Our patients can tell a difference.
And most people love that temperature, correct?
Oh, yes, absolutely.
It's not that when you hear 92, you think hot because of summer, but in the pool, it's fabulous.
Some of the other patient types that use our pool or have therapy in the pool are pediatrics, and that's something we haven't really touched on. We have a very large pediatric population in Dyersburg that our therapists see, and quite frequently they will get some of the patients in the pool that may have CP or cerebral palsy or different osteogenic conditions that might prohibit them from exercising on the land. In the water, the therapists actually get in the pool and work with the patients in the water, and it can be very beneficial.
We have the same at our facility as well. We have a large pediatric population. And like Kathryn said, especially like those are the kids we have that have cerebral palsy, they tend to have a lot of tightness in their musculature, and the warm water, like we mentioned with the temperature, really helps for them to get really good stretching. You can work on their posture. You can work on like sitting balance. So many different things with the kids in the water. And we see different diagnoses. We have kids that have Down syndrome or genetic defects, just different things. So, and again, just like with our adults, we tailor their program to what they need. So if we have a kid that's having a lot of balance issues, we'll work on balance. If we have a kid that just needs a lot of stretching, we work on that.
Well, that is amazing. Most people don't even realize you guys are doing pediatrics as well. I mean, I'm sure that in Dyersburg community, they realize that because of the size of the community and the word of mouth. But in Jackson, we're very large. And when you think therapy, you usually are thinking just a clinic for children. So that is great to know that you're providing this service for the pediatrics along with adults. After hearing about the pediatrics, I also understand there is the expecting population that you guys can also treat. Y'all want to elaborate on what you can do and how water will help them?
Yes, we do treat patients that are pregnant. As some may know, when you're pregnant and as you progress through your pregnancy, you can get a lot of ligament pain, a lot of low back pain. So water is actually a great environment for this patient population. Again, going back to some of the principles we talked about earlier, that buoyancy just helps offload. And I cannot tell you how many women that we've had that are pregnant, as soon as they get in that water, it's like the most relief they've had. And we've had several of that patient population throughout the years, and they've all done really well. And again, like the buoyancy we talked about, the warmth, that helps too because your muscles are tight. So it does help. We still do, some strengthening exercises, some core stabilization exercises, because sometimes with that patient population as well, they have some pelvic alignment issues. We work with them that way too.
So if I was expecting and I had this pain and my doctor did not recommend it, and probably didn't think about it because they're there for the pregnancy. Mm-hmm. But if I'm listening to this podcast and I'm thinking, oh my gosh, that fits me, can I call you direct? Am I able to do that? So you can direct access to them. So that's like self-referring?
Absolutely. Yes, we do direct access. So you just call our clinic and we'll get you on the schedule. Again, the evaluation will be land-based, and that's so we can assess you, see what's going on, and set that plan of care. And then after that, we set that program for you to do your water-based therapy.
And that's for any patient, not just specifically expecting population. Okay.
Absolutely. Any patient that's having any kind of joint pain, balance issues, they can call and with direct access, just get a direct appointment with a therapist.
And what's that number that to call?
In Jackson, area code 731-668-4449.
So if I lived in, say, Milan and I called the Jackson number, you guys would make sure I get referred to the correct place. Is that correct?
Yes. If you do live like in Gibson County, so like Kathy said, if you live in Milan and you happen to call our clinic, we do offer to try to get you closer to home. Of course, you're always welcome to come to Jackson. And we have 14 clinics in West Tennessee, so we pretty much have a clinic anywhere that can help you. But again, like she mentioned, we have 4 specific aquatic clinics, so we will get you as close to home as we can.
Now that you have touched base on pediatrics, adults, as well as expecting ladies, what about cardiac patients? That's a specific care, and that is one of the number one things out there in the world that is hitting all every human being is having cardiac problems. How's the water work with that? Do you guys take that type of patient?
Absolutely. We do treat cardiac conditions in the water. Most often those referrals do come from your physician, because we do like to work with the cardiologist on that, because it is a more detailed patient population. With that patient population, we're checking their vitals. We're performing exercises in a very safe manner.
So when you're saying checking their vitals, making sure their blood pressure is not going up or spiking, to make sure the exercise is not increasing their heart rate. Is that correct?
Correct. One interesting thing about the water, your heart rate's about 14 beats per minute less in the water versus on land. And so it's not as stressful on the heart, especially like if you've had a bypass surgery. So you've had an actual heart surgery and you're working on regaining your endurance and your functional capacity in the water, because you don't have that excessive workforce or workload on the heart. We can push you a little bit more in the water, and you will gradually gain that cardiac output throughout it. We do check vitals. We check their blood pressure. We check heart rate. We check oxygen saturation at the beginning, throughout the session, and then at the end. So we're constantly monitoring that patient. Also with that patient population, how we mentioned earlier about the different depths of the water, you don't want to get them more than 25% in the water, especially patients that have congestive heart failure. The hydrostatic pressure can affect that. So they're just a more sensitive population that we just very closely monitor and have very specific tailored exercises and very specific points in the water that we place these patients.
And the outcomes are really really, really good. Is that correct?
Yeah, absolutely. And one of the biggest reasons patients that have cardiac issues do come to us, especially if they've had, like I mentioned, a cabbage procedure or bypass surgery, they may try that traditional route of doing cardiac rehab, and they may have other comorbidities like, chronic back pain, knee pain, and they're not able to tolerate and get that cardiac conditioning on land. Then they come to us because we can get them in the water. It doesn't hurt their back as much. It doesn't hurt their knees as much. And that's just kind of an added benefit if they're having those issues as well.
That is great to know, because there's so many that are experiencing this problem, and knowing that, like you said, 25% is where you're going to take them. Can you take them beyond that after they've gotten used to this and they're starting to improve? Do you go more in the water?
No, not with that patient population.
That's good to know. So if you're listening and you're thinking, oh, I don't want to get in the water, that's too much pressure, too scary for me with my heart condition, do know they are monitoring you, they are watching you, and there are limitations that they know we do not surpass. As we're wrapping this up, I wanted to make sure people do understand that aquatic therapy is available in 4 locations. That is in the Humboldt, Dyersburg, Jackson, and Milan location. So if you're living in West Tennessee and you're looking for physical therapy, and Jackson is a drive for you, but you're always welcome in Jackson. We will take you to Aquatherapies, but do keep in mind these other 3 locations do have a pool and do have the therapists that are trained to take care of you there. Ladies, is there anything else you'd like to add or encourage the people listening to come see you guys? What about the hours?
In Jackson, we actually have kind of a non-traditional kind of clinic hours. We're open Monday through Thursday. We start at 7 in the morning until 7:30 at night. Fridays, we're open 7 in the morning until 5:30. So, if you're working and you're trying to fit therapy in with your work schedule, we start early, we're there late. Also, some people just aren't early birds. Some are. So we try to be there and be available and flexible. So.
And in Dyersburg, our hours are 8 to 5, and we do have extended hours on Tuesdays and Thursdays, and we're open Monday through Friday.
So what are the phone numbers? If I'm a patient and I want to reach out, how do I get in touch with you guys?
Okay. In Jackson, it's, of course, area code 731-668-4449.
And in Dyersburg, we're 731-286-1115.
This has been great to learn about all the Aquatherapies options that are in West Tennessee. If you ever have any questions, feel free to call the numbers that they mentioned earlier, or if you have a question that they did not address, feel free to email us at wetalkhealthpodcast@gmail.com. This has been another episode of We Talk Health.
We have 14 convenient locations to serve you, so if you're experiencing any type of pain, or if you just have a simple question, you'd like to give us a call, you can call us at 800-427-0957. We have 5 in Madison County. That would be our Sports Plus North, South, our Sports Plus Aquatherapies, Lift Therapy, and Work Plus Rehab. Yes, Lift Therapy is part of our Sports Plus, so keep that in mind as well. If you also are living outside of the Jackson area, we have Sports Plus Alamo, Brownsville, Dyersburg, Henderson, Humboldt, Lexington, Medina, Milan, and Trenton. So if you are living in West Tennessee, we have 14 convenient locations for you.